I'm Dr. Sahil Khanna. I am an Assistant Professor of Medicine and a Clinician Investigator Fellow in Gastroenterology and Hepatology at Mayo Clinic in Rochester, Minnesota. In an upcoming issue of the Mayo Clinic Proceedings, our group has written a review titled Clostridium Difficile Infection, New Insights into Management. In this review, we discuss the epidemiology, risk factors, and focus on the newer treatment modalities for C. difficile infection. C. difficile infection was first thought to be the cause of diarrhea in humans in the late 1970s. The early on incidence of C. difficile was stable until the early 1990s, and since then there have been several studies that have shown an increase in the incidence of this infection. Studies from national databases have shown that the incidence of this infection has increased from about 2.5 to 5-fold from the early 1990s to the late 2000s. In one unique study that we did from the Olmsted County, where we included both hospital and community-acquired infection, we saw that this incidence had skyrocketed from the early 1990s to the late 2000s. Of note, we also found that about 40% of all C. difficile infection was community-acquired, which was not seen previously. Additionally, we have seen that there are newer emerging risk factors for C. difficile infection. The traditional risk factors for C. difficile infection are thought to be hospitalization, older age, and antibiotic exposure. Newer emerging risk factors include exposure to gastric acid suppression medications like proton pump inhibitors, and other risk factors like immunosuppression, chemotherapy, or increasing comorbidities. The treatment for C. difficile infection includes general measures of infection prevention and hand hygiene, maintaining the fluid and electrolyte balance, and drug therapy. If a patient with C. difficile infection is admitted to the hospital, he should be placed in isolation, and strict hygiene measures should be incorporated, including hand washing with soap and water and not alcohol rubs. These patients should be managed carefully for fluid and electrolyte balance. Medical treatment options for C. difficile infection include drugs like metronidazole, vancomycin, fidaxomicin, and some additional investigation drugs. For patients with mild to moderate C. difficile infection, metronidazole is usually the first line of therapy. This is not FDA approved, however, it has shown in several studies that it is effective for this infection, as it has similar efficacy to other drugs for mild or moderate C. difficile infection. In patients with severe C. difficile infection, vancomycin is the approved drug of choice. This is FDA approved, and usually a 10 to 14-day course is enough for a patient with severe C. difficile infection. A new drug called fidaxomicin has been recently FDA approved for C. difficile infection. This has been studied in a head-to-head trial against vancomycin and has found to be non-inferior to vancomycin for cure. And it has also been seen that patients with C. difficile infection who get treated with fidaxomicin have lower recurrence rates than vancomycin. Other treatment options for recurrent C. difficile infection include fecal microbiota transplantation. This is based on the fact that C. difficile infection is caused due to a disruption in the normal microflora due to antibiotic exposure. It has been long thought that if the human microflora is restored, this could help treat C. difficile infection. Several recent studies in the last 2 years have shown that stool transplant or fecal microbiota transplantation is an effective modality for cure for C. difficile infection with cure rates over 85 to 95%. There are several considerations that need to be taken place before this therapy can be used. Stool from a donor is processed in a lab. The donor needs to be tested for infections and communicable diseases, including C. difficile infection. This stool processed in the lab is then infused via an enema or a colonoscopy or put into a recipient. This is not FDA approved, but has been shown to be very effective in the treatment of C. difficile infection. So in summary, this review focuses on the changing epidemiology, highlights some new risk factors, and talks about the newer management options for C. difficile infection.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.